Good morning. I'm Mike Larson, President and CEO of the Michigan Association of United Ways. Welcome to the virtual release of the 2021 MichiganALICE Report. We've adapted this year's event to a virtual format to adhere to safety regulations amid the COVID-19 pandemic. Before we dive into report findings, I would like to recognize the many local United Ways hosting virtual watch parties for today's event and contributing every day to the efforts that benefit Michigan residents. I encourage members of the media who are watching to connect with your local United Way after the event is over. If you are unsure who that local contact is, please contact our public relations team and they will be happy to help you. I would also like to thank members of the Michigan Legislature who continue to lend their voices to this initiative. Governor Whitmer, who we will hear from in a moment, has been tremendously supportive of the ALICE report, and her Michigan Poverty Task Force used the data to inform its recently released recommendations. We were proud to join her in support of those important policy discussions. You also hear from State Senator Jim Stamos, who we are thrilled to have with us today supporting the ALICE community. It's this bipartisan support for Michigan's most vulnerable residents that is critical to improving outcomes. You see, we all know who fall into the category of ALICE: assets limited, income constrained, employed. They're the households where hardworking Michiganders still have to make tough choices about basic necessities. Whether it's deciding between quality child care or paying the rent and picking up groceries, these decisions have long-term consequences, not only for ALICE, for all of us. Unfortunately, as the 2021 MichiganALICE report shows, there is significant work to do. Low wages, reduced work hours, and depleted savings, combined with increased cost of living, have made for an uneven economic recovery in Michigan. Specific findings from the report include the following. In 2019, more than 1.5 million households, 38%, could not afford basic needs. And that was before the pandemic hit. The total number of Michigan households that could not afford basic needs increased by 6% from 2007 to 2019. Those basic needs include things like housing, childcare, food, transportation, and health care. Of Michigan's 3,960,000 households, 13% were below the federal poverty level, and another 25% were under the ALICE threshold, arriving at the 38% total. According to a data point new to this year's report, an additional 10% of households in Michigan were on the cusp of the ALICE threshold in 2019, with over 236,000 households just one income bracket away. In the 7 years since our first ALICE report, new data sources have become available. As a result, with the release of this year's report comes added local variations, a better reflection of household composition, and new ALICE data points that give us a clearer picture of who ALICE is and the challenge ALICE faces in Michigan. We also have an interactive report on the website this year, allowing easy access to the number at a state and local level so you can easily see the ALICE data relevant to your community. By showing how many Michigan households were struggling in 2019, the 2021 ALICE report provides the backstory for why COVID-19 crisis is having such a devastating economic impact. The data shows the ALICE population was completely unprepared to weather a storm like the one we have faced this past year. And those we have relied on the most, essential workers, were often receiving the least. We have the information we need to improve the lives of Michigan residents. Now it's time to do the hard work of improving outcomes for ALICE. Here to talk about that work is Governor Gretchen Whitmer.
Thank you for joining us today for the release of the 2021 MichiganALICE Report. Over the course of the last year, we have come to understand many of the things we value most as Michiganders. When faced with the unthinkable, a devastating virus, and historic economic downturn, we learned more about the people we rely on. In times of adversity, we look to the helpers, the nurses, teachers, bus drivers, retail workers, skilled workers who keep us all going. The frontline workers who showed up so many of us could stay home. They're the ones we turn to when times got tough. And yet, as this year's 2021 MichiganALICE Report shows, many of those same helpers are in desperate need of our support. According to the report, 38% of Michigan households in 2019 weren't able to make ends meet, and that was before the pandemic hit. For essential workers, the numbers were even worse. 70% of infrastructure jobs paid less than $20 an hour. 63% of nurturers, those in healthcare, education, and caregiving, made less than $20 an hour. Those people we needed most, we haven't been there for them when they needed us. Low wages, reduced work hours, and depleted savings, combined with increased cost of living, have made for an uneven economic recovery in Michigan. Worst of all for our frontline workers. While we haven't seen the numbers from 2020 yet, we know they're not going to be good. No parent should have to choose between paying rent and putting food on the table. We need to better serve all those in need through programs that strive to improve the health, education, and financial security of all Michiganders. We need to use what we know to work towards solutions for all families. To build Michigan's economy back better, we must stay laser focused on getting Michigan back to work. We need to jumpstart our economy. We need to help Michigan families and small businesses get back on their feet. We have the information we need to do it. Now let's get it done. Thank you.
Hello, I'm State Senator Jim Stamos of the 36th District and Chairman of the Senate Appropriations Committee. The United Way's ALICE project helps shine a light on the real problems facing many Michigan families as they struggle to make ends meet. As the 2021 report is released, we know a few things in advance. Like thousands of people across our state, ALICE households have been hit hard by the pandemic and the state's ongoing restrictions. Many of these households are workers who are providing for their families and are critical to our state's success. They should never have to choose between paying their child care, health care, car insurance, and putting food on the table. I'm proud that we have continued focused investment in the state's budget and in the COVID-19 relief measures to support these families by increasing support for education and job training, reducing the cost of child care for affected workers, increasing pay for the frontline workers, providing extra unemployment benefits, increasing access to affordable health care, helping increase access to the internet, and supporting job providers who are struggling to stay open so that they can continue to offer good jobs. The new ALICE report offers an updated look at the hardships facing the Michigan people, and I remain committed to doing everything we can to help those in need as we recover from this COVID and economic crisis in helping our state recover for all Michigan families.
Hello, my name is Carolyn Bloodworth. I'm the Secretary-Treasurer of the Consumers Energy Foundation. At Consumers Energy, we believe it's critical to ensure all Michigan residents have a chance to succeed. As a company that prides itself on caring for the communities we serve, we're proud to be working together with the Michigan Association of United Ways and its member organizations to support this ALICE research. This is an extension of the decades-long relationship we've enjoyed with United Ways across the state. Some may ask why businesses like ours have a stake in ALICE's well-being. The fact is, all businesses should be concerned about the ALICE community. Economic instability among our state's residents impacts all of us. I know Alice, and so do you. Alice is a mother struggling to raise her children while also caring for an aging parent. Alice is a college student attending classes by day and waiting tables by night. Alice is a senior citizen choosing between prescription medications and groceries. The ALICE report identifies the scope of the issues facing many families here in Michigan. The report provides us with data that can shape decisions to move our communities forward. It's of benefit to policymakers, the business community, and the leaders of our local communities. This report makes it clear that ALICE families face pressure every single day. We know life is unpredictable and situations can change in the blink of an eye. These ALICE families are a major car repair away from disaster. They work hard, often working very long hours, and they don't have an opportunity to get ahead. They make a wage that places them just above the threshold for assistance, but not enough to move them out of a situation where one setback can throw them into chaos. Our support of the ALICE report is one effort among many that we all are doing to make our state stronger. At the Consumers Energy Foundation, we look forward to continuing to give Michigan cities, towns, and neighborhoods the extra support needed to build communities that we're all proud to call home. To serve ALICE residents and those in similar circumstances, we will continue to work with the United Way and other Michigan nonprofits to provide grants and mobilize our employees and volunteers to strengthen local communities. It's what we do. We invest in what's most important to Michigan, our planet, the prosperity of our state, and most of all, its people. As you've seen here today, it's critical that the business community and our state and local legislators band together in support of the United Way and other nonprofits in their efforts to better serve the ALICE population in Michigan, as they are a vital part of our community. Together, we can create sustainable communities that are able to thrive well into the future. Thank you.
I work for office furniture manufacturer. We make filing systems, filing cabinets and such. I make too much money. I make too much money to qualify for food stamps or any other assistance, but I don't make enough money to make ends meet all the time, which I fall in that category, which it's so frustrating. Because I need help and I would like to help, but I can't get it because I just simply make too much money. So I don't think that I need a permanent leg up, and I don't want a permanent leg up. I'm not asking for permanent assistance. I'm just asking for a little bit of help now until the pandemic is over with. Before the pandemic, I think I still struggled, but it wasn't as much of a struggle. It's coupled with the pandemic and then the fuel prices continuing to go back up and the cost of food going back up, and it's hard, but we're making do because, like I said before, we have no choice but to make do.
My name is Felicia Parker and I live in Kalamazoo. I am single. I have 4 children, age 23, 17, 7, and 5. I had to think about that. But only the 2 younger ones, the 7-year-old and the 5-year-old, live with me. I guess when people look at me, because I do have a very good job, they're like, well, what do you mean you can't afford to eat? Or what do you mean you can't do this or that? I'm not lazy, I'm not sitting at home doing nothing. I'm trying to do the best I can with the situation that I've been dealt. There have been times to where I've gotten side jobs, but then there again, what happens is that counts as your income. So then if you already are on the cusp of being able to get any help, the little extra income that I do get that would help my family, then in turn counts against me because now I'm making more money. Because I make too much money, I don't qualify for any financial assistance as far as with daycare from the state. And so my daycare was, I was blessed that my daycare was willing to work with me because they didn't want us to have to drop out due to cost. And I also think it's frustrating because people who look at, wow, you make, X amount of money, you should have this, you should have that. And realistically, when they take taxes out and stuff, luckily I do have car insurance, and I'm able to put gas in my car. But I mean, there have been times, like I said, my oldest is 23. There have been times to where I didn't have car insurance on my car because I had to worry about how I was going to get back and forth to work. Or there were times to where I had to take my child to a family member who could watch them, so then that way I could afford to buy us groceries and stuff. It was really hard. It was really hard because I'm used to doing things myself and being very independent, and I had to swallow my pride and ask, a friend to let me stay with her while I work out the logistics of daycare and, other household bills.
My name is Kristen Cronkright. Our home life at home is that we are a bit of a blended family. We don't have any health insurance because my husband is laid off and our insurance was through him. Our youngest children were able to receive Medicaid. And the older children have their own insurance. But my husband and I do not have any health insurance. In December, both of our entire family actually ended up with COVID over Christmas. So we were home with COVID. Nobody working at that time. That included me. I could not work at that time. But that was very difficult to get through that Christmas, not have even me being off during that time. And then being worried about, we found out that we had COVID because I had to take my husband to the emergency room, and there was the panic of how are we going to pay for an emergency room bill without any insurance. But it was something that we had to do, that it had to happen. He had to go. He was very sick. We kind of joke around and use the term, and it's a kind of a common term, robbing Peter to pay Paul. That is a monthly situation for us anymore, that it's always kind of trying to figure out, okay, who can we pay next? There's always that lying out there that things are gonna change, or the kind of wondering of like, okay, so when is the first major vehicle repair is going to happen, or what are those things what's going to happen next is always the fear of, it's just going to be that one thing that's going to kind of put it over the edge. And so far even though we've come pretty close to that edge, we've been pretty fortunate, but it's not going to take much.
I'm Lea Ellis. I currently live in Lansing, Michigan. I have 4 children. My eldest is 20 years old. I am, with me running my own company, I have experienced a lot of changes because I'm now homeschooling my 3 children, and it takes up a lot of time during the day, of course, so it interferes with a lot of business that I have to do. The onset of my disease started in 2012. Had my first seizure in 2012. I was about 29 years old, had never had a seizure in my life. And then from there, I started having a lot of muscle weakness. Things just started going crazy. Like sometimes my muscles would twitch really bad. My legs would shake really bad. I wasn't able to, stand and hold myself up. So it was just insane. So I was going to the doctors, the neurologists, everybody. So from 2012 until 2019, I had no idea what my diagnosis was. My disability is very limiting. It's very debilitating. Like, I can't believe how the progression of the disease has evolved in my body since 2012. It's really, really insane. And it's depressing at times as well. It's really difficult to deal with. The fact that you can't go outside and run with your children. I do receive assistance for food, which is absolutely great, but I do still have to spend extra out of my cash for food because I have 3 children who are growing and they're here all day. I didn't realize how much more food was necessary to have your children home all day, like every day. That definitely has been the most challenge for me. With with Water and Lights, I'm on their payment protection plan. I was paying every month, but after the pandemic hit, I called and asked to be on their plan. So I'm on that. So financially it's a struggle every day. It's definitely a balancing act as far as, keeping up with your finances and the bills that are due. So I currently have a bill that is a lot of money and I don't have the money to pay for it. So I'm paying just a little bit monthly, and I'm praying that it doesn't get cut off because it's not fully paid. So you have to prioritize your money and what's most important at that time. And if it's not most important at that time, you have to either make payment arrangements or you can't let it go because you need your lights, right? You need your heat, you need the gas because it's wintertime right now. Just the different circumstances in my life got me to, I've never been on low-income housing before. This is the first time in my life that I've ever had to be in low-income housing. However, me being in low-income housing, it helps to provide, a place for my children to stay, but it doesn't make me less of a person.
In releasing our fourth ALICE report, the Michigan Association of United Ways aims to continue to inform the conversation about the real and present needs of our residents. We remain committed to serving ALICE and all those in need through programs that strive to improve health, education, and financial stability of all Michigan residents. We also call on our state policymakers and business leaders to use what we know about ALICE to work toward a Michigan we can all be proud to call home. We support the work of the Governor's Poverty Task Force to push forward policies that do just that. Members of the media can find the report on our website at www.MichiganALICE.org. I encourage you to direct any questions or interview requests you might have to our public relations team. Thank you for joining us for this release of the 2021 ALICE report. Now let's get to work. Thank you.